this is Jessica DeMassa at the HISA Studio here at HIC 2017, and I'm with Tim. Tim, please introduce yourself for everyone watching.
Hi, yes, I'm Tim Shaw, I'm Professor of E-Health at University of Sydney.
Fantastic, it's good to have you. So one of the big topics of conversation here at HISA this year has been workforce preparation, and so you're on the front lines. Tell me what are you teaching your students? What are you preparing them to know?
It's very interesting. We've actually just finished a study across our whole university around actually what we need to look at, and I think it's really important we align what we teach our undergraduates to what's actually needed in workforce. So that's what we've focused on. And it's been a little bit surprising actually. It's much less about how to use the technology, but how to deliver good care and how technology surrounds that.
Talk a little bit more about that. What surprised you about that?
Well, I guess we expected people to come back and say you've got to be able to use Cerner or My Health Record, but it's actually much more about how you integrate them into your practice and how you change practice with that. The other key bit that's come up a lot's been actually getting clinicians to be part of the design process, and that's come through very strongly. So actually, because the only thing we're certain of is that they're going into an uncertain environment, so we actually need clinicians to be able to operate in that, but to actually be part of the process of redesign, which we're going to have at least 10 to 15 years of rolling innovation, and we need clinicians to be part of that. So that's what we're really teaching as well.
Now, are you finding that there's a great deal of interest in these types of classes at the university?
Oh, yeah. It's certainly beginning. At the moment, we've got most of the workforce is kind of what I call kind of a curious workforce. So people that are actually self-selected to be in that space in working in digital health, and we need to make this transition to actually creating people that fit in that role, so actually have kids that want to go out and study this. So we're certainly starting to get that wave, particularly in the technology. People are going, wow, there's obviously lots of jobs in this, so they want to get that health experience, and increasingly I think health professionals that see the advantage of digital health.
That's fantastic. And so what can we expect? I mean, how quickly can you train the Army, so to speak, for integration really into the workforce?
I guess there's lots of different kind of troops in the Army,
right,
if you like. True. So, I think we need lots more clinicians that can take on the kind of what we call the CIX roles, so the Chief Information Officers, whether they're medical pharmacists or whatever. So we need to be able to train them. That's probably through master's programs and that type of work. I think then there's a whole health informatist workforce, which is what you're kind of talking about. And I mean, we can turn them out. We could have a course, within a small number of years. But the key thing, we've got to have the jobs, because we've had disasters like this before, where we've actually created a workforce and there hasn't been the jobs for them. So we need to actually then work with the workforce planners to say that, if we pump out 100 health informatists, there's going to be 100 jobs for them. And then you can't wait 2 years, because then they'll suddenly do something else. Yeah.
So tell me a little bit about, I mean, that's obviously one blocker to this developing as a career path. Is there anything else that can be alleviated to help kind of create the space for this new crop of health informaticians?
Look, I think one of the other key things is that we're stuck in the plumbing at the moment. So most of the conversation we've got at the moment is to get the plumbing right. That's what I call it. It's to get the EMR out, it's to get that kind of in place. But I mean, that's not the exciting bit. The exciting bit is what we do with this technology, how it transforms care, how the data's incorporated into practice. So that's what we've got to train for. And that's one of the challenges we've got, because that's yet to be realized. So we're actually training for something that we haven't realized. But then we need that workforce to be there to kind of catch that. And we've got to get over this kind of bramble bush of plumbing kind of problems to get to that realization.
Among current practitioners, are you seeing a lot of uptake in terms of continuing education?
I don't think I wouldn't call it a flood yet. I think as I said, I think we're still at that place where many of these people probably could have tipped into clinical practice or into data science. That's what I'm trying to find. I think that mainstream flood, there's a huge interest though. So if I ever run anything in the university on digital health, boom, we will have 100 people there. That's not always about the education piece, but there's this growing enthusiasm for digital health that I haven't felt 5 years ago. So I think that will transfer into people seeing job opportunities and things like that as well. I've been approached by probably 7 or 8 young clinicians at this conference saying, what should I do, a PhD? Should I, so there's interest growing around that.
That's fantastic. Well, good. Well, we look forward to watching this workforce develop, and thank you so much for the role you're playing in educating them.
That's a pleasure.
Thank you so much for joining us here in the HISA Studio. This is Jessica DeMassa at HIC 2017.